Good morning, all. I'm Linda Sangalli, previous resident of the University of Orofacial Pain of the University of Kentucky. And today I'm going to present to you the results of the retrospective study conducted on our orofacial pain population. And in this project, we investigated whether there were a relationship between the occupational status of our patient and their orofacial pain complaint in terms of clinical, sleep, and psychological variables. So we did a retrospective chart review of all consecutive adults seen at the orofacial pain clinic, and we collected the variables displayed here on the figure number 1 on the left-hand side. Demographics were retrieved in terms of age, sex, employment status, so employed versus unemployed, and job category. And for the psychological variable, we collected insomnia symptoms, satisfaction with life, anxiety, depression, and then we also collected the self-reported pain intensity and pain-related disability. But what we did was to retrieve the same occupational status with the state of Kentucky, so that we could really assess whether an occupation was over or underrepresented compared to the average national data. So moving to our result, the analysis was done on 444 patients, with an expected higher female preponderance. And as displayed in the pie chart in figure 2, 65% of our sample was employed, and 35% of them were unemployed. And of these, the vast majority was constituted by retired, followed by disabled status. Now, if we look at table number 1 on the bottom hand side, this clearly showed that there were 3 main categories overrepresented compared to the data of Kentucky. These were art design category, followed by healthcare providers and education instruction. These were overrepresented by 3.4, 3.2, and 2.76 respectively. And among those, the 2 most common professions were teacher in 11% of the case and nurses in 10% of the case. And finally, if you look at the right-hand side of the panel, the box plot shows that among all the employed and unemployed categories, those with disabilities score significantly worse in all the psychosocial functioning and pain variables compared to employed patients. They also score worse compared to students and the retired patient in some other psychological variables, such as insomnia, sleep quality, satisfaction with life, and pain. And no difference was seen between the other job categories. So in conclusion, nurses and teachers were overrepresented among the employed patients seeking treatment for chronic orofacial pain. And future studies should explore the job characteristic that predispose a certain profession to orofacial pain complaint. Thank you.